Hey, welcome everybody. This is our Spinal Workshop series. Tonight we're going to be talking about Tylenol and Ibuprofen. I have with me my associate doctor, Dr. Jacob Helms, and we're going to be doing a fireside chat today. So we thought we'd bring some levity and brevity to the Spinal Workshop tonight. This topic is very common. As you and I were talking, it kind of gets not a whole lot of spotlight because it is so common, and it kind of gets drowned out amongst other things such as painkillers, steroids, and things that we talk about a lot in our office. So again, we do these spinal workshops. We try to keep these around 10 minutes just so we can share with you some of the knowledge that we know and what we've gathered, so that you feel informed and that you can make decisions. So let's dive into this. So Dr. Jake, I know the first one we're going to talk about is acetaminophen, most commonly Tylenol, some of the side effects. I know you did a lot of research coming into this. So what were some of the things that stood out to you that maybe are not a common thing that patients of ours know, other than, oh, hey, I'll just take a Tylenol?
Well, I think one of the things that you really start to look at is, yeah, you can get into the side effects and its normal uses, but when you really start diving into it, there's a lot of things that really mimic allergic reactions that we don't really look at. A lot of skin rashes, blistering, redness, hoarseness in your voice, or even difficulty breathing comes up as some of these potential side effects, which if you look at any sort of drug commercial going on, is the end is a list of side effects that go in that we're just supposed to glance over. But really, that's a big part of, hey, in clinical trials, we're seeing these things that are unintended consequences of this drug. So, things that even can go into, like, if you're allergic to Tylenol, anaphylaxis, you're unable to breathe, you're having an allergic reaction, that'd be something that'd be emergency room ready. But so often we just, we're just taking a Tylenol, it's no big deal. I had a little bit of a headache, I'm gonna take a Tylenol.
Sure. Well, some of the brand names, again, you may not know that these contain acetaminophen, but I think the one that stood out to me, obviously you put Dayquil, NyQuil, common flu, flu relief and things like that, but how about Percocet?
Percocet, absolutely. You're having your oxycodone and your acetaminophen, which is your Tylenol. So that combination is something that jumps off as Percocet, which when you hear Percocet, even when you hear oxycodone, this is a very powerful drug, when part of that is something that, again, we take so casually throughout our day, where, most people just don't even think twice. No big deal, you have a fever, here's part of a Percocet, really, and part of the chemical dosage.
Right. And speaking of chemicals, going down through this, one of the things that you really spotlight in this conversation had to deal with pregnancy, and you should tell, a heads up, hey, I am taking this, or is there a chance you're being pregnant? And if you want to, explain kind of, yes, the obvious, but let's also look at that from the other angle, the 90-degree angle of, well, if they're telling a pregnant woman she shouldn't have this, how does that pan out to us common folk?
Absolutely, and you think about that even from just something as simple as alcohol, right? If you're pregnant, stay away from alcohol. You're bringing in those toxins into your body, and originally you look at that as, well, yeah, you have baby growing there and developing, we want to keep away from fetal alcohol syndrome. So we're telling you, hey, these toxins are bad for you, don't take them when pregnant. Now, when you look at that from a grander scope, we're telling you it's bad for you.
Right.
We're saying the quiet part out loud. We don't want any unintended consequences towards that developing baby, but it's the same thing when you take something as simple as Tylenol. Headaches are more common than what we like to admit, and how much of that goes underreported as well. We talked about headaches recently in one of these spinal workshops. How often would someone who's pregnant, you just take a Tylenol, take Tylenol for headaches? Well, that's a chemical you're putting into the mother's body that's gonna then find its way into that fetal blood system, into how that baby develops in such a critical time period there. And you really don't want any of those birth defects. We don't want to talk about it, but that is something that is relevant, and you're increasing the risk of having those complications through pregnancy, delivery, how that baby is now born and grows up. You know, how much of that chemical being put into the equation is that baby impacted going forward?
Right. And again, you know, we say this one kind of flies under the radar because we talk about Pitocin, we talk about, you know, epidurals and things like that, you know, when it's time to deliver a baby. And, you know, those have a little bit more, I don't want to say, again, I'm going to stick with the spotlight analogy of, oh, well, that has a lot of other things that can cross over through the umbilical cord and things like that. But these are the ones that throughout pregnancy, like you said, they may just pop an ibuprofen or Tylenol and not think twice about it.
Mm-hmm.
So,
not even going in, like, just through the development, that's its own thing. But even for a nursing mother, that still impacts it. So when you talk about the importance of breastfeeding, a lot of the, you know, immune system that gets passed from mother to baby through that breast milk for all nursing mothers. Well, acetaminophen and Tylenol is one of those things that can also transfer through that breast milk. So, great, you made it through the 9 months of pregnancy, everything's great there. Well, now I have a headache even though I'm still nursing. Well, that chemical's still gonna find its way through the mother's system and make its way to baby. And now we're essentially giving a very diluted dose of Tylenol to a baby who doesn't even need it.
sure. So, you know, when we look at, again, risks, one of the things that really does not get discussed is things like heart attack. If you have heart disease, the risk of stroke, and other, you know, one of the ones you commonly hear, GI bleeds, with taking a lot of that. I mean, I've literally sat in this room and had a patient tell me they took, I think, upwards of 24 ibuprofen in a day. And then we also have, you know, patients who, you know, take those like they're eating a bag of Skittles on a daily basis every single day, and they don't think twice about it.
Mm-hmm.
And then just like, you know, other addictions and caffeines and things, well, if 2's good, 3's better, and then that continues to become that ladder. So what are some of the things that, you know, a patient could use? Obviously we'll get into chiropractic care and the uses for headaches, as you mentioned, and aches and pains and things like that. But what are some of the other things that you may recommend off the top of your head instead of ibuprofens or Tylenols and things like that?
Well, a lot of times, you know, ibuprofen's used as more of an anti-inflammatory. So that is one of the first things that, you know, hey, my elbow hurts. I'm gonna just pop an ibuprofen and don't worry about it. Tylenol can be the same case for that too. But, you know, using ice, cold therapies typically are a great anti-inflammatory. I love movement as an anti-inflammatory process there. And you also kind of have to look at the nutrition. You know, how much sugar is that person taking in as well? Because sugar itself is going to cause more gut inflammation there. You're adding more inflammation to the body, more inflammatory properties there that is going to have an impact there. So ice is always my favorite. There's really, you know, cold therapies, cryo, you know, cold plunges, I know are all the rave, things like that. That's always a big thing going forward. But
well, I think we did a video about this, it was a while ago when I had my knee procedure, and my doctor who, when I had a PRP injection and BMAC injection in my knee for a meniscus, was the supplement of turmeric, and to kind of use that as a more of a natural, healthier version of, hey, if you're thinking of using Tylenol or ibuprofen, try this instead.
Absolutely. There are other options that, you know, I know turmeric's more of like a root in terms of that's just ground up those anti-inflammatory properties. You know, looking to nature opposed to looking to the lab. I think that'll help out a lot with our health as a whole as we go forward.
Very good. And, you know, when we get into aches and pains, specifically headaches, because we've just kind of been on that run, is, you know, always have your spine checked. Because, again, as we shared with the headache conversation a few weeks ago, you know, really the root cause is quote-unquote unknown, but really when you dive into it, the speculation is a cervicogenic disorder, which you and I translate that to a subluxation in your cervical spine or somewhere in that area that, again, if that's adjusted, we have the normal curves of our spine as we should. Again, headaches are not normal, they're common.
Right.
So, again, you know, as we close this this conversation out, I kind of liked our Fireside room chat.
I think this might be something.
We might roll with this a little bit more. So again, have your spine checked. We know the benefits of that. Again, if you look at some of our Google reviews, you'll see things. I know one was just shared yesterday for heartburn. They had no idea that chiropractic care could help with that. And at the end of the day, you hear me say this all through the COVID time frame, is the stronger our body, our host is, because it's super intelligent. And as long as we watch out for thoughts, traumas, and toxins, our body knows how to heal broken bone. It knows how to fight off virus and bacteria. So we need to keep that as healthy as we can.
Absolutely.
So thank you guys for tuning in, and we'll look forward to seeing you next week for our next Spinal workshop. Thanks.